Good day, dear students. I am Chimidrov Sergey Nikolaevich, the head of Human Anatomy Department in Samara State Medical University. Today we'll talk about anatomy of blood vessels in head and neck. First we will talk about arteries, and next we will talk about veins of head and neck. So let's start our lecture. And first I want to tell you about the biggest vessel, biggest arteria in our body. It's called aorta. Aorta starts in left ventricle of heart, and you may see the parts of aorta. First part is ascending aorta, next part, second part is arch of aorta, and third part is descent aorta, which divides with diaphragm in two parts, thoracic aorta and abdominal aorta. And you may see that abdominal aorta at level of fourth lumbar vertebra divides into common iliac arteries. And also you may see a little artery which called medial sacral artery. But in details we will talk about these bodies arteries, thoracic arteries, abdominal arteries, and also pelvic arteries, where we will study anatomy of cavities in our body. So let's talk some words about aorta. As I told you, the aorta is the main arterial trunk of systemic circulation, carries blood from left ventricle of heart. So the following three sections can be distinguished, and you may see this section on this picture. Ascendens aorta begins as a marked bulbous expansion. You may see this bulbous aorta here. Within this distension are three sinuses in the aorta, found between the wall of the aorta and the cusps of its elbows. The ascending aorta is approximately maybe 6 centimeters long, but the ascending aorta and the pulmonary trunk behind which is located are still covered at this point with the pericardium. So behind the manubrium of sternum, or breastbone, as you know, the ascending aorta is continuous with the arcus aorta. And when we study heart and blood supply in heart, we also talked about branches of ascending aorta. And you know there are coronary arteries, left and right coronary arteries. So next part is arch of aorta, and you may see this arch here, and you may see three constant branches of arch aorta. And you may see brachiocephalic branch on the right side. Also you can see carotid left artery, common carotid artery, and also you may see left subclavian artery. And as I told you earlier, the thoracic part and abdominal part, which divides with diaphragm, hiatus aorticus and diaphragm, in details we will study when we will study bodies artery, cavities artery, and also internal organs arteries. Let's in details talk about arch of aorta. You may see this part of aorta here on this preparation, and also this picture. You may see brachiocephalic artery on the right side. So the brachiocephalic artery is maybe 6-7 centimeters long, and it divides into arteries. You may see here right common carotid artery and also right subclavian artery. And at the left side of aortic arch These arteries origin individually from arch of aorta, and you may see the names of these arteries: left common carotid artery and also left subclavian artery. Arteria carotis communis sinistris in Latin, and also you may see Arteria subclavia sinistris in Latin too. So you also may see the variations of originate from aortic arch. On this picture you may see that the branch of subclavian artery, which called vertebral artery in number 3, starts not from subclavian artery like in usual cases. It starts from aortic arch like here. And also you may see aortic preparations here that then vertebral artery starts also from aortic arch on the right side. Next you may see the variations of originate of branch in aortic arch, and you may see there are a lot of cases, so several cases you may see on this picture. But now you know that the computer tomographic investigation and also magnetoresonance investigation may show the individual features of origins of these arteries from aortic arch. But I may tell you that in these cases, for example, you may see right and left brachiocephalic truncus here and here. Also you may see right and left brachiocephalic trunks here, and also you can see that left common carotid artery starts from right brachiocephalic trunk. It's abnormal, but these cases are usual in our life, and for detailed investigation we must check this anatomy via MRI or computing tomography investigation. And also you may see various anatomy of arteries which start from aortic arch. So as I told you, in usual cases, I repeat that on the right side it's more than 70% in people starts brachiocephalic trunk or brachiocephalic artery, and on the left side of aortic arch start two vessels, two branch, left common carotid artery and also left subclavian artery. Next, let's talk about common carotid artery. You may see this artery on this picture here. So common carotid artery develops from ventral aorta between the 3rd and 4th branchial arteries, and as I told you, it arises from the brachiocephalic trunk on the right, it independently from the arch of the aorta on the left side. In common cases, more than 70% of cases. Both common carotid arteries run upward on the side of the trachea and esophagus. The right common carotid artery consists only of cervical section and is thus shorter than left, which consists of the thoracic section, from the arch of the aorta to the left sternoclavicular joint and cervical section. The common carotid artery passes to the trigonum caroticum on neck. You may see this trigonum regio here, carotid trigonum here, and at this trigonum or triangle, it's in English, trigonum it's Latin, we may touch the pulsation of this artery. Boom, 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 yes, of course. So as I told you, it goes to the region of carotid triangle at the level of the superior border of the thyroid cartilage. It's a level of superior border of carotid thyroid cartilage. Carotid common artery divides into terminal branches. So, and you may see on this picture that it gives now the branch for organs and tissues without, it goes without branch, yes, but you may see two terminal branch which arise from common carotid arteries, common carotid artery, and they called external carotid artery. You may see here, and also bigger internal carotid artery. But this place in common carotid artery is called bifurcation. To arrest bleeding, the common carotid artery is pressed to the tuberculum caroticum of a sixth cervical vertebra at the level of inferior border of cricoid cartilage of larynx. Sometimes the external internal carotid arteries arise not from common trunk, but separately from the aorta, as I told you earlier, in some cases, and so you must remember about these cases because it's very important to save the life after damaging of these arteries. Next, we talk about some abnormal branches which go to, for example, you may see here to thyroid gland, and you may see the abnormal branch from aortic arch. It's called, you may read here, arteria thyroidema. This is impaired thyroid artery. And you know that thyroid gland produce hormones for life, for catabolic processes in our body. And in details you will study these hormones in physiology and also in biochemistry, but we must remember about this abnormal branch. Why? Because in emergency cases every doctor must open the respiratory tract here, and you know, maybe you may hear the surgical operation which called tracheostomia. And when the doctor cut this part of trachea for opening the going air for respiratory tract, he may damage this artery, and blood bleeding starts in this difficult case. Of in a patient. And you may see this in abnormal case here when thyroid artery, it may be in 10, maybe 15 persons of cases when this artery passes from aortic arch to thyroid gland. But in usual cases, only 4 main arteries go to thyroid gland. You may see 2 superior, left and right, superior arteries, and also you may see 2 inferior thyroid arteries. I want to tell you that 2 superior arteries to thyroid gland go from external carotid artery, but to inferior thyroid arteries go from thyroid cervical trunk, which start from subclavian artery. So let's in details begin to talk about external carotid artery. You may see this artery here, and also you may see the difference between external and internal carotid arteries on this picture. So you may see that external carotid artery gives branches on the neck and head, and you may see some branch which arise in external carotid artery. But if you see the internal carotid artery here, you cannot find the branch which arise from this artery at the neck, because there are no branches on internal carotid artery at the neck region. So, the external carotid artery supplies blood to the external part of head and neck, therefore distinct from the internal carotid artery penetrating into the cavity of skull. And you know that internal carotid artery goes to carotid canal of temporal bone. The origin of external carotid artery is at the level of posterior belly of digastric muscle. Most of the branches of the external carotid artery are remnants of the branchial arteries and supply organs derived from the visceral arch with nutrients. There are three groups of branches of external carotid artery: anterior, posterior, and middle. So first we talk in details about anterior group. You may see three arteries of anterior group: thyroid superior artery, lingual or tongue artery, and facial artery. And you may see this artery here. So let's in details talk about these arteries. Superior thyroid artery arises from the external carotid artery. Yes, of course. Immediately above the origin, you may see the origin and the origin of external carotid artery, and also you may see the origin of superior thyroid artery. And it runs downward and anteriorly to the thyroid gland, where it anastomoses with the other thyroid arteries. What the other thyroid arteries? I told you that these arteries are opposite superior thyroid arteries from maybe, for example, left external carotid artery, and so I told you about inferior thyroid arteries, which arises from thyrocervical trunk. So along the way, it gives branch to sternocleidomastoid muscle, and so it gives branch for thyroid hyoid muscles, and also for larynx. It gives superior laryngeal branch for larynx, for blood supply of larynx. So the superior laryngeal artery goes to laryngeal muscles, to mucous tissue, and also for cartilage and connective tissue of larynx. And I repeat that this artery is drawing here on this picture. Next, second anterior branch of external carotid artery is lingual artery. Lingual artery arises at the level of greater hearts of hyoid bone, and you may see the hyoid bone here. Runs upward to lingual triangle. This is little region of neck here, and it names via lingual artery passes here. It's covered by hyoglossus muscle and passes to tongue. So it gives branch for tongue muscles, and also for sublingual salivary gland. So the terminal branches of lingual artery are arteria profunda linguae, the deep lingual artery, and also the dorsal lingual arteries, which passes to mucous tissue of tongue. And a third anterior branch of external carotid artery is facial artery, and you may see this facial artery here. So a facial artery rises slightly above the lingual artery. You may see here on this picture too, and also here. This is lingual artery is scattered, and you may see the facial artery here. It passes medially of the posterior belly of digastric muscle and reach the anterior border of the masseter muscle. So this artery has two parts: cervical part, and you may see this part that is situated at the neck region, and next it goes over the mandible, in front of masseter, insertion of masseter muscle. You may see it here, and it goes to angles of oral fissure, oral rima, and next it goes to the internal angle of eye rima. So you may see the branches of facial artery here. First, you may see the branch to salivatory submandibular gland. Next, you may see the branch which goes from cervical part of facial artery to tonsilla, palatine tonsilla. It's named palatine tonsillar ascent branch, or it's in Latin arteria palatina ascendens, to supply of blood of palatine tonsils. And next it goes to the face region over the mandible, and you may touch the pulsation of this artery here in front of masseter muscle insertion. And also you can see the branch of the facial part of facial artery. You may see the superior labial artery, inferior labial artery, the muscular arteries, which gives a blood supply for mimic muscles of face. And also you may see the terminal branch, terminal part of facial artery, which goes to internal angle of rima oculi, and it's named terminal branch is named angular artery. Here, angular artery. And also you may touch the pulsation of this artery here at the medial part of rima, eye of eye, and palpebral rima, and at the dorsolateral side of root of nose. So next, let's we talk about posterior group of external carotid artery. There are three arteries of posterior group of external carotid artery. First artery, or maybe one, maybe some of them, 3, 4 little arteries, passes from external carotid artery to this sternocleidomastoidous muscle, and they give blood supply for this muscle. Rami sternocleidomastoidea, or sternocleidomastoid branch of external carotid artery. Second branch is occipital artery, and you may see this artery here, this picture, and also you may see this initial part and also terminal parts of this occipital artery. So arteria occipitalis, it's in Latin, arises below the posterior belly of the gastric muscle, lies at the sulcus of in middle part of mastoid process of temporal bone, emerges under the skin in the occipital region and gives off branch which stretch of the vertex. Occipital artery gives some very small branch for surrounding muscles here at the occipital part of head, and also it gives a branch for skin, hair part of skin of head, and gives anastomotic arteries for connection with arteries of temporal superficial artery system, and you may see this anastomotic branch here. And also it gives a branch for auricle and also for dura mater of brain. These meningeal arteries, posterior meningeal arteries, passes through the bones, occipital bone to dura mater, and gives a branch for this meninges. Next, a third branch of posterior group of branch of external carotid artery is posterior auricular artery, arteria auricularis posterior, rises above the posterior belly of the gastric muscle, runs upward and the back onto the skin behind the auricle. And you may see this region of the head behind the auricle, reaches the region of parietal tubers. It branched and distributed both outside the ear, and also gives branch inside the ear to tympanic cavity, and their branch penetrates through the stylomastoid foramen of the temporal bone, and gives branch to tympanic cavity and also to mucous tissue of tympanic cavity. The middle group, you may see one of middle group artery on this picture between external and internal carotid artery here, and also a little part of here. You may see this little part of this artery here. This is ascending pharyngeal artery, arteria pharyngea ascendens, arises from external carotid artery close to its origin and ascends to the wall of the pharynx and supplies it. Also, it gives branch for soft palatine, also palatine tonsil, Eustachian or Eustachian tube, Eustachian tube between tympanic cavity and nasopharyngeal region, and also to tympanic cavity. One of its branch go through the foramens of skull to dura mater for meninges of brain, and also it gives branch, tympanic inferior branch to tympanic cavity. It passes through petrosus fossula to supply the mucous tissue of tympanic cavity. So next, let's we talk about superficial temporal artery, arteria temporalis superficialis. It's in Latin. One of two terminal branches of external carotid artery. So these two arteries, first is superficial temporal artery, and second is you may see the origin of maxillary artery. Two of these arteries are terminal branches of external carotid artery. So you may see the first terminal branch, a superficial temporal branch, and also you may see the place of pulsation of this artery here in front of external basic part of auricle here, and also you may see the branch of this superficial temporal artery. This artery can be pressed here to the temporal bone, as I show you, to stop the bleeding after damaging this artery. So at the level of superior orbital border here, it divides in two large anterior and posterior branches, ramus frontalis, frontal branch, and ramus parietalis, parietal branch, which branch out in the region of the vertex and temple. The artery gives a branch to the parotid glands. It gives branch for parotid glands here, salivatory gland, one of greater salivatory gland, parotid gland. So the lateral surface of auricle, external acoustic meatus, and you may see this little branch for these organs here. One of the branches arising from the superficial temporal artery below the zygomatic arch passes forward next to the parotid duct and branches out on the posterior surface of the face. So you may see this artery here, so another branch originates above the zygomatic arch and runs to the lateral angle of eye. So you may see this artery and this artery. This cut above the zygomatic arch orbital branch, and it forms anastomosis with the other branch of frontal branch of temporal superficial artery here, and also you may see the branch which go to the face, to the mimic muscles from this artery, transverse faciae, facial transverse arteries or branches which form anastomosis with the branch of facial artery. Next, the second terminal artery from middle group is maxillary artery. maxillary. You know that maxilla, this is a Latin name of superior jaw. So this maxillary artery classified into three sections, three parts: 1, 2, 3, first, second, and third. The first curves around the neck of the mandibula. Around the neck of mandibula, you may see that this part of mandible is catted. It goes on the middle surface of the head and neck, also most of neck of mandible or column mandibular. So second passes to the intratemporal fossa of skull, and third part of maxillary artery passes to the pterygopalatine fossa. You may see this fossa here. So the branches of the first section are sent to the external acoustic meatus. You may see here to this branch, anterior tympanic branch and deep auricular branch. Next branch is middle meningeal branch, which passes through the spinous foramen of sphenoid bone to meninx of middle cerebral fossa. And also you may see inconstant accessory meningeal branch, which passes through oval foramen to middle cranial fossa, to meninges. And you may see the largest branch of first part. This is inferior alveolar branch, which passes to, you may see in details here, to mandible canal, and it gives a branch for muscles of oral floor, and for example, for mylohyoid muscle, you may see here mylohyoid branch of this artery, and also you can see that this branch goes through the mandible canal, and in canal it gives a branch for inferior teeth, and also it finished via mental artery from mental foramen, and it gives branch for inferior lip, and also for mental region of face and neck. And here you may see the branch for incisor dents or teeth, and for gingivitis or gums, gingiva and gums. Second part of maxillary artery you may see here, and as I told you, this part is situated in infratemporal fossa of skull. You may see this region here. This part of maxillary artery gives branch for muscles, masticatory muscles. You may see posterior deep temporal muscle, anterior deep temporal muscle, branch for temporal muscle, posterior and anterior. Also you may see pterygoid medial and lateral branches for blood supply of medial and lateral pterygoid muscles. Also you may see mesenteric artery for blood supply of masseter muscle, and also you can see the anterior deep temporal artery for blood supply of anterior parts of temporal muscle. And at last you may see the buccinator or cheek artery for blood supply of cheek regions, also for cheek wall, mucous tissue, and also for mimic muscles of cheek, mimic muscles of cheek. Third part of maxillary artery is situated in pterygopalatine fossa of skull, and you may see the branch of third part of maxillary artery. First you may see infraorbital branch, which passes through inferior orbital fissure, and it passes on infraorbital sulcus. Next it goes to infraorbital canal, and it passes through this canal, outside this canal, to infraorbital foramen, and gives a branch for face structures, for mimic muscles, for skin, for inferior palpebra, for nose, for dorsum or radix of nose, and also for superior lips, and also for mimic muscles of superior upper lips. Next, sphenopalatine artery, which passes through sphenopalatine foramen, and it gives a branch for lateral valve, nasal cavity. These arteries are named lateral posterior, superior and inferior nasal branch for blood supply, a lateral wall of nasal cavity. And also you may see pterygoid artery canal, which passes to pterygoid canal and gives branch for bones, bony tissue of sphenoid bone. And also you can see pharyngeal branch and descent palatine branch. Pharyngeal branch make anastomosis with the pharyngeal ascent artery, which passes from initial part of external carotid artery, and also you can see descent palatine artery, which goes through the greater palatine canal, and it divides in 2 or 3 branches. One of them is major palatine artery, and 2 or 3 inconstant lesser palatine arteries. All these arteries give branch for molum palatine and also for dura palatine, for bony tissue. And also they give branch and make anastomosis for septal arteries, for inferior parts of nasal septum. So there were the branch of external carotid artery. I repeat that there are 9 constant groups of branch. 9 branches, 3 groups. That's right. So first group is anterior group of branches, and there are 3 anterior branches. I repeat: thyroid superior branch, lingual branch, and facial branch. Next, there are three posterior or back arteries of external carotid artery. There are sternocleidomastoid artery, occipital artery, and posterior auricular artery. And at last, three middle arteries. One of it is really middle artery. This is ascent pharyngeal artery, and two middle branches are also correctly called terminal branch of external carotid artery. First of it you may see here superficial temporal artery, and second is maxillary artery. And I want to also repeat that some of these arteries you may touch. You may touch the pulsation of these arteries. As I told you first, the carotid triangle of neck, you may touch the pulsation of common carotid artery and also external and internal carotid artery here. At the face region you may touch the facial artery in front of masseter muscle here, and also you may press this artery after damaging to stop bleeding. And next you may touch the angular artery, the medial rima of palpebra, and also the dorsolateral part of nose here. And also you may touch the superficial temporal artery in front of superior basic part of auricle here. So you may touch in yourself the pulsation of these arteries. And next you may touch in patient when you will become doctor. So next we talk about internal carotid artery. This is very important because the more parts of brain takes the supply from this internal carotid artery. So you may see the first part of internal carotid artery here. Also you may see that external carotid artery is carotid, and you may see that internal carotid artery has no branch at the cervical region. Has no. This is the main difference between internal and external carotid artery. There are cervical branches in external carotid artery, and there are no cervical branches in internal carotid artery. And also in details you may see ascent pharyngeal artery of external carotid artery. You may see it here. So also on this picture you may see the second main artery, which passes to cranial cavity and gives branch for brain. You may see two main arteries for blood supply of brain: internal carotid artery and vertebral artery. In details, first we will talk about internal carotid artery, like one of branch of common carotid artery. But next, in details, we must talk also about vertebral artery, because it's very important to understand the blood supply in brain. So there are four parts of internal carotid artery. First part, as I told you, is cervical part, which goes to external orifice of carotid canal of temporal bone. There are no branches, as I told you here. And after the orifice of temporal carotid canal, second part of this artery starts. Second part is called bony part or temporal part. So this part has band here or flex here. and also it has branches. First branch from internal carotid artery pass from this part, petrosous part or bony part of internal carotid artery. These arteries are called carotid tympanic arteries. Carotid tympanic arteries. They are thin, small branches penetrating the posterior wall of carotid canal and passes into tympanic cavity for blood supply of mucous tissue of tympanic cavity. Third part is spongious part. Spongious part passes through spongious sinus. Spongious sinus of dura mater of Manning's of brain. You may see this part here. And fourth part is brain part of internal carotid artery. You may see the bands of this internal carotid artery like spring. It goes like spring in skull. And also you may see all three parts in skull and first cervical part without branch here. So internal carotid artery has four parts: cervical, I repeat, cervical, petrosous or bony part, which passes in temporal bone in carotid canal. Third part is spongious part, which passes through the spongious sinus here, and also it gives branch for this sinus and also for hypophysis. And fourth part is cerebral part. So you also may see the branch, terminal branch of brain part or cerebral part. You may see anterior cerebral, middle cerebral, superior hypophyseal, communicantous branch, and first branch in cerebral part is ophthalmic artery, which passes in orbit through the optical canal with optical nerve. So it passes through this canal. Before the passing, it gives the branch for Manning's, for dura mater, and it forms also anastomosis with the branch of arteria mingia media arteries. And in orbit, this artery gives branch for eye bulb and also for the accessory apparatus of eye bulb, for muscles, for gland, lacrimal gland, for fatty tissue over the eye bulb, and also it gives branch for Manning's of anterior skull fossa, anterior cranial fossa. You may see the anterior and posterior ethmoid arteries, and these arteries give branch for Manning's of anterior cranial fossa. And also you may see the branch which go to mucous tissue of ethmoid bone, ethmoid labyrinthus, ethmoid cellular, and also these branches go to superior parts of nasal cavity. So the anterior and medial cerebral arteries give branch for brain. So anterior cerebral artery is smaller in size, stretches forward medially to the start of longitudinal sulcus of brain, curls around the knee of corpus callosum, and stretch along the inner surface of the cerebral hemisphere back to the beginning of the occipital lobe, and giving a branch along the way of the cerebral cortex. So, at the origin of the longitudinal sulcus of brain, it joins with the artery of the same name from the other side by means of the transverse trunk, arteria communicans anterior. I will show you this artery later. And next, the biggest artery of internal carotid artery is middle cerebral artery, passes laterally into the depths of lateral cerebral sulcus. On the surface of insular brain, it starts dividing into branches that emerge onto the surface of the hemispheres and supply the external surface of the frontal, temporal, and parietal lobes with blood, with the exception of the posterior parts of the brain which receive blood from the system of arteria vertebralis. So, next, chorioid artery. You may see this artery here. It's called anterior chorioid artery, passes back laterally, and on the reaching the surface of the temporal lobe of the brain, enters the inferior horn of the lateral ventricle and terminates in plexus chorioidus. I repeat that plexus chorioidus in ventricles in brain produce the fluid, cerebrospinal fluid. It's very important. And this artery is the main for produce this liquid in brain. And at last you may see the terminal, one of terminal branches of internal carotid artery. This one is posterior communicans artery, which goes and make an anastomosis connection with the branch of posterior cerebral artery from system of vertebral artery. So on this picture you may see the spongineous part of internal carotid artery, which passes through the cavernous system, cavernous sinus. So next, let's talk about second main artery, which gives branch for brain and other structures. So first, in details, let's talk about second branch of brachiocephalic trunk at the right side, and also I told you that subclavian artery at the left side passes from aortic arch. But you may see the right side, and you also can see that this one is brachiocephalic trunk. Also you can see subclavian artery, and you may see one of branch of first branch of subclavian artery. This one is a vertebral artery. So what we can talk about this artery? You know that internal carotid artery has 4 parts. Yes, I told you about this earlier. And also the vertebral artery has 4 parts. Let's rename these parts. So you may see that first part is prevertebral part. This is part of this artery from origin of this artery in subclavian artery, and the end of this prevertebral part is entrance to the foramen of 6th cervical vertebra. sixth cervical vertebra. So from this part, sixth cervical vertebra, to second cervical vertebra, the second part of vertebral artery passes. Second part. It's called transverse part because it passes through transverse foramens of cervical vertebrae. Third part is Atlantic part. You may see the bands over the Atlantic transverse process foramen. It passes through it, band, and goes to the sulcus of vertebral artery on the atlas of first cervical vertebra. Next, it perforates the membrane between atlas and occipital bone, and next it goes to the cavity of skull. And fourth part, you may see it here, it's called intercranial part because it's situated inside the cranium. So I told you about 4 parts of vertebral artery. First part, prevertebral artery between subclavian artery and 6th cervical vertebra. Second part is passes through the transverse foramens of 6th, 5th, 4th, 3rd and 2nd cervical vertebrae. Next, third part is Atlantic part. You may see that it forms convolutions over the atlas and its transverse foramen. And fourth part is penetrate the membrane, Atlantic occipital membrane, and passes into skull cavity, and it named intracranial part. Let's talk about the brain's arteries in details, and also about anastomosis. So you may see the intracranial part of vertebral artery, and also you may see the terminal part of internal carotid artery here. So what we can see here, vertebral arteries confluence into basilar artery. You may see it here. So before it they give branch for cerebellum. You may see the posterior cerebellum, posterior inferior cerebellum branch. Next you may see other branch for spinal cord. This is anterior spinal artery. And you may see that right and left spinal artery are confluent and passes downward to spinal cord and form this rhombus. You may see that arterial rhombus formed with the vertebral arteries and spinal anterior arteries. Next, you may see the formation of basilar artery with the 2 vertebral arteries. It forms on the clavus of occipital bone, on the basilar part of occipital bone or medial part. And also you may see the anterior superior cerebellar branch for cerebellum, internal auditory branch for internal iris, internal auricle, for vestibulum and cochlea, for labyrinthus, and also you may see the pontins and we cannot see here oblongate medullary branches for blood supply to these important parts of brain, pons and medulla oblongata. Next you may see the superior cerebellar branch for cerebellum here, And also you may see the posterior cerebral arteries to blood supply, to give blood supply for posterior parts of brain, for occipital lobes, for cortex of occipital lobes, and also for medulla of occipital lobes. And what we can see here too, we can see posterior choroid arteries. Also, we cannot see here hypophysis arteries, but in details we can see internal carotid artery, and it branches middle cerebral artery, anterior cerebral artery, and also posterior communicans artery. And also you may see the anastomosis between the arteries of internal carotid arteries from one side, and from next side vertebral arteries here. You may see anastomosis between vertebral and middle and internal carotid arteries here. This anastomosis, like circle, you may see it here over the thoracic sella and also over the hypophysis. It's called large arterial circle of brain. This is very important for understanding the blood supply of brain, and also you must know that this anastomosis is unconstant, because it may be absent of maybe at the right side or at the left side. And at the next pictures I want to show you the abnormalities of rhombus or small arterial circle. Here, as I told you and show you here, you know that spinal anterior arteries form the rhombus, arterial rhombus, but here you may see the variations and abnormalities and absence of this anastomosis here. You may see at picture number 9 and 10 the absence of formation of basilar artery. You may see it here that vertebral artery passes individually upward without formation of basilar artery. But these pictures you may see the absence of formation of rhombus or small arterial circle. And now you may see the abnormalities of formation of basilar artery. You may see the normal basilar artery here. You may see also the vertebral arteries and posterior cerebral arteries. But here, at that, since second to sixth picture, you may see the abnormalities. You may see that basilar artery forms here at inferior part. Next, it divides to two basilar arteries and forms alone basilar arteries upward. So you may see this short basilar artery. You may see the absence of formation of basilar artery with anastomosis here between right and left artery, and without anastomosis between these right and left arteries. Next, on this picture you may see the abnormalities and variations of formation of large arterial circle. You may see the normal picture, and also you may see also the variations of this formation. Maybe here, for example, in number 3, you may see that vertebral artery passes upward and form anastomosis with the middle cerebral artery. So you may see also the several anastomosis between anterior cerebral arteries. Also you may see the absence of formation basilar artery, as I told you earlier. Next, you may see the absence of formation posterior communicans anastomosis between middle carotid artery and posterior cerebral artery, and also you may see the absence of the opposite side between these arteries. Also you can see the absence of anastomosis and also the absence of formation basilar artery. You may see that vertebral artery passes individually and form anastomosis connection with the internal carotid artery. On this picture you may see the absence of formation connection between system of internal carotid artery and vertebral artery of subclavian system, and so you can see also the absence of posterior communicans arteries. So we talked about arteries of head and neck, and I want to repeat that arteries for blood supply of structures in head and neck passes from carotid system, external carotid artery, which gives a branch for superficial structures, also from internal carotid artery, which gives branch for brain and its surrounds, and also for eyes and its surrounds, and also for tympanic cavity. And next, you know that second vertebral artery goes from subclavian artery, and it gives branch for cervical part of spinal cord, for cervical vertebrae, and also for cervical brainstem, cerebellum, labyrinthus, internal auricle, and also for posterior regions of brain, occipital lobes. And in details we talked about anastomosis connections between the arteries of these two systems, internal carotid arteries and vertebral arteries. Also, I told you about blood supply from subclavian artery to cervical structures such thyroid gland, larynx, pharynx, cervical part of esophagus, and I told you about inferior thyroid arteries, which passes from thyroid cervical trunk to thyroid gland, and also to larynx with the inferior laryngeal branch. And also you must know about two arteries with passes to cervical muscles, deep muscles, and also middle muscles. So they passes from a thyroid cervical trunk, the superficial cervical artery and transverse cervical artery, and also suprascapular artery. Suprascapular artery passes to scapular region to form blood supplying of these muscles. So in details you will study these arteries at practical classes. But now we must talk also about veins. You know that vein, this is a vessel which pass the blood from organ to heart. And you know that in big circle of blood supplying there are two greater veins, the superior cava vein and also inferior cava vein. But in details we'll talk about superior vena cava, because this vein store the blood from the head and neck, and also from superior thoracic regions, also from superior extremity or hand. Yes. So what we can see at this picture, superior vena cava is thick about 2.5 centimeters and short 5 maybe 6 centimeters, trunk located to the right and posteriorly of a center aorta. So it's formed by the merger of two brachiocephalic veins. You may see the superior cava vein here and also brachiocephalic veins. So it forms at the level of first rib and passes to right atrium of heart. So this is one of the branches of superior vena cava, which called Impaired vein or vena azygos. It passes to superior vena cava. But you may see the roots of this vein or branch of this vein, as I told you about brachiocephalic vein. So brachiocephalic vein, right and left, and you may see that topographic features of right brachiocephalic vein, which form at the level of sternoclavicular joint. It passes more vertically, but left vein is more longer and it passes more obliquely. But two these veins are formed behind the sternoclavicular joints. So brachiocephalic vein are formed from also two veins, internal jugular vein and also subclavian vein, here and here. You may see also some of branches of this vein. In front of the right brachiocephalic vein is covered by muscles, sternocleidomastoid, sternohyoidus and sternothyroidus muscles. So the branch from thyroid gland here, from thyroid venous plexus, also from larynx, also from mediastinum, are passes to these brachiocephalic veins. So you may see the formation of these veins here behind the sternoclavicular joint, and also you can see that internal jugular vein and subclavian vein form this brachiocephalic vein, for example, of the right side. Next, let's talk in detail about features of veins. You may read these features here. So I told you that veins pass the blood from organs to heart. Veins are similar to arteries. The pressure in veins is low, the blood moves slowly, so the veins are characterized by the large lumen, a thin, easily filling wall with a weak development of elastic elements. Many veins have valves that are derivatives of the inner membrane. So, features of the structure of the vein were poor development of inner elastic membrane, poor development of circular muscle layer, more frequent longitudinal arrangement of smooth myocytes, smaller wall thickness compared to the wall of the corresponding artery, higher content of collagen fibers, indistinct delineation of individual membranes, stronger development of endothecia, weaker development of intima in middle membrane. And also in veins, this is more important feature, presence of valves inside the veins. But I want to tell that venous valves are in constant in the veins of hand and neck. More their absence, the valves in vein of head and neck. But some of valves may be situated in these veins. So you also may see some words like venous plexus. There are anastomosis of the veins forming three-dimensional structures, and also venous network vein anastomosis form planar structure. So the roots are venous vessels forming the venous trunk. You may see vena cava again, superior vena cava here, and also you can see on this picture vena cava superior and brachiocephalic vein. More vertically and shorter, this one is right brachiocephalic vein, and a longer and oblique dimension is a left brachiocephalic vein. Next, let's talk in details about internal jugular vein. You may see this vein here on this picture, this one. And also you may see the carotid arteries, common carotid artery, external and internal carotid arteries. So, internal jugular vein carries blood from the cavity of the skull and the organs of the neck, beginning at the foramen jugulare in skull, where it forms a distension or bulbous superior. The vein passes downward laterally of arteria carotid interna and further down laterally of arteria communis. A second distension or bulbous inferior, you may see it here, is formed at the lower end of vena jugularis before it joins to vena subclavia. There are one or two valves in vein in the region of the neck above this distension. In the back of region of internal jugular vein is covered by musculus sternocleidomastoidus, it's cut on this picture, and omohyoidus muscle. You may see this muscle here. So, the sinuses drain blood into vena jugularis interna. You may see the sinuses of dura mater, of dura meninx here. So you may see the branches, intracranial branch of jugular internal vein, brain veins, sinuses of dura mater, and veins of dura mater. Also ophthalmic veins, veins labyrinthicus or inner ear, diploic veins inside the bony skull, and also veins emissarius, which connect the superficial veins with internal or intracranial veins. So on this picture you may see the veins of brain, cortical veins, or superficial brain veins, which passes the blood to the sinuses of dura mater. And also you may see the sinuses of dura mater. This is important to understanding the features of these veins, because these veins have now the muscle tunic, and the fibrous connective tissue form the wall of these veins, and they have constant lumen inside them. Constant lumen. So you must know the sinuses. You may see, for example, superior sagittal sinus, sinus confluens, rectus sinus, which passes from inferior sagittal sinus. Also you may see transverse sinus, which passes to sigmoid sinus, and also you may see the sinuses of basilar part of skull. You may see petrosus sinus, superior and inferior sinuses, sponginosous sinus, also cavernosus sinus, intercavernosus sinus, and also you may see at the edge of a lesser sphenoid wing or ala minor of ossis sinoidalis, you may see the sphenoparietal sinus here. So what we can see at this picture, we can see the superficial veins. Also we can see the veins inside the bony tissue here, diploic veins, and also we can see inconstant veins between superficial and deep veins. They're called emissary veins. On this picture you may see the diploic veins, temporal anterior, posterior, parts of frontal, and also occipital diploic veins. You may see that these veins are situated between two compact parts of bony tissue, which called sponginosous part of bony tissue, and also it's called diploic bony tissue. And also you know that veins which are situated here are also called diploic veins. So on this picture you may see ophthalmic veins, which passes from eyeball and its surround. You may see that there are two main ophthalmic veins, superior and inferior ophthalmic veins, which passes to cranium cavity. Superior ophthalmic vein passes into middle cranial fossa through the superior fissure, superior orbital fissure, and the blood goes to the cavernous sinus. So the inferior ophthalmic vein has anastomosis between a superior and inferior ophthalmic vein here, and this vein passes inside the inferior orbital fissure, and the blood passes into a pterygoid plexus, and next it passes to retromandibular and facial veins. Next we can see the superficial parts of internal jugular branches. You may see the facial vein. Also you can see temporal superficial vein, and here you can see that the blood from plexus pterygoidus passes into this temporal superficial vein, or also to the common facial vein. which forms with the confluence of facial and temporal superficial vein. So you may see plexuses, the three-dimensional anastomosis of veins, pterygoid plexus here, surround the pharynx. The pharyngeal plexus is situated, and also surround the thyroid gland, as I showed you earlier, is situated impaired thyroid plexus. So next you may see the facial vein, as I told you. We cannot see here lingual vein, but we can see a retromandibular vein, which is passing of temporal superficial vein downward. So also you can see the formation of common facial vein, which passes into internal jugular vein. Next, you may see in details facial vein here. Also, you may see the anastomosis between the veins of facial vein, the vein of temporal superficial veins, and also via infraorbital canal, inferior and superior ophthalmic veins. This is very important for understanding the metastasization of oncologic diseases and also separation diseases. So you may see, for example, the photo of Alexander Scriabin, famous Russian musician. He died after separation of this region of cheek, because there was separation in his face, and the pus metastasis passes through the veins anastomosis to the brain, and he died after this complication of this metastasis. Also, you can see the facial vein, which passes from face to neck. And in details, you may see the pathways of these metastases also. For example, with Scriabin, you may see the facial veins here at the superficial part of face, and you also may see the anastomosis between facial veins and inferior orbital veins. Also, you can see here the anastomosis between inferior and superior orbital veins, and also you may see the pathway through the superior orbital veins, through the superior orbital fissure to cavity of skull, to sinuses of meanings. And so you may see generalization of separation. And Scriabin died after meningitis and encephalitis, the inflammation of brain and meninges. So we talked about internal jugular vein, but now you must know that two other veins are formed at the posterior part of head. You may see this one is external jugular vein, and also on the anterior part of neck, anterior jugular vein. You may see external and anterior. So the blood from occipital skin, from posterior region of auricle, go to the veins, the branches of external jugular vein, and next it passes inside the platysma muscle and perforate the fascia second fascia of Shevchenko or proprial fascia of cervix, and it passes into venous angle between internal jugular vein and subclavian vein. So the anterior jugular vein is formed the anterior part of mental region, and it passes downward, and the branches take blood from anterior part of neck, and it also perforates the proprial fascia of cervix, and also passes into angle between internal jugular vein and also subclavian vein. For example, you may see the confluence between external jugular vein and also between the angle which formed with the internal jugular vein and subclavian vein here. So in details on this picture you may see the anastomosis which caught anterior jugular arcus or arch in English, arcus in Latin, between these anterior jugular veins. It's called arcus venosus juguli. It's in Latin, or jugular arch between two anterior jugular veins. And also on this picture you may see the plexus, venous plexus, over the thyroid gland and also over the larynx. And you may see three groups of thyroid veins, superior, middle, inferior, and also impaired, which pass the blood to the system of internal jugular vein and also to the brachiocephalic vein. Next you may see this vein in details: superior, middle, and inferiors, maybe impairs, inconstant blood supply of thyroid gland. So the lecture is over. We talked about the very important part of anatomy, about blood supply of head structures and neck structures. And so these structures are very important for understanding the operations in head and neck regions. And for example, I talked with you about tracheostomia, and you must remember about inconstant branch of aorta, such as arterial thyroid edema, and also you must know about constant venous anastomosis, the plexus thyroidus impaired over the thyroid gland, and also arcus venosus juguli, venous arch between two anterior jugular veins. Because if you cut these vessels, you may give complication for a patient. So I think this lecture was very interesting for you, and I consider that this lecture helps for you to understanding anatomy and also surgery of head and neck regions. Thank you for your attention. See you again at the next lectures.